We will be discussing and talking about the disturbances in the developmental dentition. So there is some terms that you need to understand is what is anodontia, hypodontia and oligodontia. First of all, you should be know this is a very basic term, and any dental graduate or any MORTH candidate and anyone should know these basic terminologies. So we should be aware of these two terms. Anodontia. Anodontia is complete absence of dentition. Anodontia is the complete absence of the dentition. No dentition will be around, and this commonly occur with the syndromes. And other than syndrome, this is a rare condition. However, it can happen. Then another term is the oligodontia. Oligo means that the number of teeth that are absent in the oral cavity are more than 6.
Okay.
If the more than 6 teeth are absent, then you will be saying it as the oligodontia. Okay? And
Okay.
hypo means hypodontia mean less than 6 teeth are absent
Okay.
other than third molar. So now, when describe about the oligodontia and hypodontia, we exclude third molars. The third molar, the definition of the hypodontia and oligodontia is basically comprised of two components. One, less than 6 teeth and more than 6 teeth in the oligodontia, more than 16 in the hypodontia, less than 6 teeth. And the second part of the definition is excluding the third molar. We do not count the third molar when we are counting the number of teeth that are missing in the oral cavity. So for the mnemonics, in order to understand, in order to memorize it, you can memorize it by like this. For oligo, you have already O for here, and you just add it over this, then this will give you more than 6 teeth. In the disturbances and the development of the dentition, you need to remember 3-4 points as per this book. One is that when exactly this problem originates, this problem of the congenitally missing teeth developed during the very initial stages of the development. This occurs during the initiation and proliferative stage of the development. We have different stages of the development. When we have a congenitally missing teeth, this problem arises during the initiation and the proliferation stage of the development. So the point is this, that we look for the congenitally missing teeth for the treatment planning reasons. Another thing you need to remember that this oligodontia and this hypodontia occur more commonly in the syndromes. These two conditions, because these two conditions are a very aggressive form of the missing dentition. Okay, so now you have anodontia, which is the complete absence, and oligo, which is more than 6 teeth excluding the third molar, and this more commonly occur in the syndromes. Okay, so if you are having a very aggressive condition like anodontia and oligodontia, this means that this is a total absence, this is the more than 60 teeth absent. This means that the systemic involvement is there. Okay, you do have the systemic involvement, but the hypo is a condition, and this is the less aggressive form. As this is a less aggressive form, so you more oftenly found less systemic involvement, and this condition may occur independent of other conditions. Talk about the we do have the primary lamella and the permanent lamella for the development of the dentition. Okay, so rule of thumb for this condition: if you have disturbance in the primary lamina, then for sure, your permanent lamina would have been affected, and there is no second thought about it. If you have problem in the primary dental lamina, then it's mean the permanent dental lamina would surely be affected. And for example, the clinical relevance of this, if you found a case of the primary dentition and you see a missing dentition in the primary dentition age group, then it's mean that your permanent dentition would surely be affected. There is no second thought about it. If you see a hypodontia in the primary dentition, then its involvement in the permanent dentition is for sure. There is no second thought about it that you would not be having the missing dentition in the permanent dentition. The permanent dentition would surely be affected, but there are chances if you primary dentition is normal and there is uh, absolutely intact primary dental lamina, but you have disturbance in the permanent dental lamina, and you would have may have disturbance in the permanent dentition. For example, its clinical relevance is this, that you may have encountered a condition where you have a intact and all the teeth are present in the primary dentition. Okay, but you may have disturbance in the permanent dentition despite of the normal presence of the dental lamina. You would be having disturbance in the permanent dentition. Okay, this point is clear.
Yes.
But if this is something missing in the primary dentition is affected, then for sure the permanent dentition will be affected, and for sure there is no second thought about it. Okay, moving on, and you know that the dentition do arrive from ectodermal. So ectoderm, the dentition to arrive from the ectoderm. So in the ectodermal dysplasia, I said these two conditions occur more oftenly with the systemic involvement. Okay, so these two conditions more oftenly occur during the ectodermal dysplasia. What is ectodermal dysplasia? Means teen, you're already aware of the word dysplasia, pre-malignant condition, and ectodermal dysplasia means that the ectoderm is affected and you would be having distortion of the structures that are derived from the ectoderm. Derived from the ectoderm means that you would be the hairs, nails, dentition, and some of the skin part are developed from the ectoderm. So having the ectodermal dysplasia, which would carry the oligodontia and hypodontia, this means that there are chances of more systemic involvement, and systemic conditions just like ectodermal dysplasia would have been present, which have the involvement of hairs. In the ectodermal dysplasia, your hairs will be sparse, thin, very less number of hairs, because the hairs would have been derived from the ectoderm. You would have problem in the sweat glands. You have problem in the skin because this outer part of the skin are derived from the ectoderm. So the structure that are derived from the ectoderm, you would be having problem in these conditions. So in these are the few salient features of the ectodermal dysplasia.